trying to identify more girls on the spectrum in a more appropriate way, studies looked at the brains of these children, and they found that the girls with autism had brains that were more similar to neurotypically developing boys. And so they actually didn't have all of that social piece to begin with. But that's really important for them. They need that. And because that's part of how they seek their friendships. And that is one of the issues that becomes really apparent early on for girls having difficulty. However, they become really good at learning how to, first, how to mask, which means they learn how to make eye contact. They learn how to watch somebody and, oh, they're smiling, I should smile. They watch someone's reaction and they're trying to pick up and imitate. They actually, overall, when we look at boys versus girls have, especially those that, when we talk about autism, there are those who have cognitive abilities that are lower than normal, and then cognitive abilities that are within the normal range. What we're seeing is there's a greater number of individuals that are fitting that cognitive ability in that normal range, but they have all these autism behaviors. And the girls have better core language, so their language skills are a little better. They also imitate and play a little better. So on the outside, they look like they're kind of normal, maybe a few little things off. The boys will have more, their pervasive interests are real pervasive. They're, only these trains, maps, highway systems, really unique solar system, knowing everything about it. Whereas girls pick up on things that are actually considered girly things, like horses and Disney characters and just having a lot of Barbie dolls and lining up a certain way. But their interest is also very, very pervasive. So we see these differences. However, as we go back to when we were talking about diagnosing has sometimes focused on the more observations that have been seen with boys. And so sometimes, to be honest, the girls can actually get by with an exam and they'll say, oh, well, they're smiling, they're doing this. The clinician may miss it. We call that false